coming to Eastern HSM, what I was really keen to do was focus on those individuals that are almost in the middle. So the middle management group, the service managers, the operational managers, who have all of the pressures of frontline service delivery and managing the workforce and supporting their teams, but also all of the outward pressures and the external pressures that come down, so performance and regulation, and that group of individuals quite often bear quite a lot of the brunt of the challenges of the health system now, today, but don't necessarily receive a lot of support. And having worked in that environment and seen how difficult it can be to get things done, we're really keen to look at a programme of support for those individuals who quite often fall between existing offers of support.
The idea that we've been working on is a virtual clinic tool to enable our service users to access our services and have appointments virtually rather than actually attending one of our sites. And at the start of the work, we didn't necessarily have that specific problem or goal in mind. But we knew that there was plenty of scope to enhance our services and the accessibility and experience of those. And through the Digital Pioneers work, that's where we sort of settled on the idea of the virtual clinics. The thing that's been sort of most encouraging and perhaps enlightening has been in recent weeks a conversation I had with one of our community psychiatric nurses, Sam, who described how our service users are, ready and able to engage with us in a digital way. And I think that was quite surprising, because I think the narrative is quite often that this is perhaps a bit too innovative and cutting edge. But Sam's directly connected to the people who use our services, and it was heartening to hear that is the case, that people are ready and wanting this. Getting the time with all those people has been a real struggle, because obviously they're busy doing their day jobs, which has meant that it's been an extended piece of work that if you looked at it from the outside, you could say, well, that could have been done much quicker, and indeed it possibly could have been. But actually, this is all about the ongoing ownership of those people who are involved in testing the solution, and then being able to evolve it for themselves.
One of the things that we've learned from the Stroke Telemedicine Service is the importance of the stroke nurses, actually, in that they've got to be educated and trained to be able to deliver the expert care the consultant is asking them to do. So in any telemedicine setup, unless the clinicians locally can deliver the care that's been recommended by your remote expert, it's pointless having a telemedicine system, because if they can't deliver the care that's being asked of them, it's pointless really. You may as well put the patient in an ambulance to the next hospital that can deal with it, which is what happened previously. So one of the things that's come out of the stroke telemedicine service is the importance of education and training, and we've appointed one of our stroke consultants as our education lead, and he's got a background in medical education. And with the cardiac and the stroke networks disappearing across the east of England, we've had no structure at all for training and education at all for nurses in stroke. So we've actually taken on that role ourselves as part of the service to be able to deliver what we call masterclasses on assessment, etc., for the stroke nurses. Now, paramedics now have largely an educational degree approach to their preparation for paramedic practice, which is relatively new in the UK, and they're now recognised as a profession in their own right. So whilst they're used to treating stroke patients and their assessments of acutely ill patients is very good, being able to decipher between what we call big sick and little sick, so patients have got patients that have generally got a straightforward stroke or relatively easy, those strokes that have got mimics, whilst they're taught the education of that in university, and I know that from first hand, actually putting some of that into practice and making assessment, a neurological assessment of a patient who doesn't fit the stroke presentation actually means that paramedics will defer to the path of the safest care and then will take the patient to a hospital. Even when, if you talk to the paramedics, they will say, actually, don't think they really needed to go to A&E, but kind of, I just wanted to be safe. So we're kind of helping to support the paramedic development. So one of the things we wanted to do is to ensure that the paramedics, whilst they're highly trained and educated and they're aware of what they're doing, is to give them some specific, what we call hyperacute stroke training. And there are a number of courses out there that we looked at, and we've kind of distilled the best bits from the research and from the other providers. And we developed initially a 3-day hyperacute training program for the paramedics prior to undertaking this pilot. With the capacity issues, what we've done is negotiated now with the ambulance service that 3 days will now become 1 day, because that's the only backfill cost that we can support to be able to release those paramedics for 1 day of their education. This is running on top of my current full-time post.
For me, getting out and speaking to the public and engaging with legal practice, I think if you're a large organisation, I think this type of work has been really important.
I think though you're right, but I think engaging with the public, we're pushing on an open door, as you say. The patients want it and they're very supportive of it. I think having a named champion, a named lead, because when you roll in this type of model out across many practices, you've got you've sort of got a coalition of the willing that are going to go and do it anyway, and you've got the naysayers that just don't want to do anything. You need for all of them to bring them all together and to try and get as many of them on the journey as you can. You need to have one person championing it who's competent and who's accessible and who's got good communication skills. So my advice to any other locality would be, find your Trish who will drive that forwards for you.